Good afternoon and welcome to Let's Chat with Dr. Celeste MD. I'm your host, Dr. Celeste Reese-Willis. I am your board certified family medicine physician specializing in urgent care. We assist busy professionals to find solutions to their both acute and chronic medical needs. We do this via our COVID-19 testing, COVID-19 vaccines, primary care, telemedicine, as well as concierge medicine programs. So good afternoon, ladies and gentlemen. So I thought what we do today is talk a little bit about the Delta variant and specifically in relation to symptoms that you guys may or may not be seeing. In addition to that, what can we do? What can we do to help, especially if you're a parent out there and has a child that is attending school? So we talked about this a little bit on CBS News this morning, and we'll be posting that on our page for you guys to have a look at that segment. But during that segment, we talked a little bit about the symptoms of a cold versus symptoms of the Delta variant. So I just wanted to go in a little bit more detail here, if I could, to kind of talk about the difference in the symptoms, especially since the symptoms are so similar. A very common question that we are getting, that we got just this morning, that we've been getting last week, is in relation to, like, how can you tell the difference? Is there anything that you can do to tell the difference? So when someone has a cold, common cold symptoms include, not limited to, but include coughing, sneezing, sore throat. You can get a mild temperature with a cold, okay? We're not seeing a lot of temperature with the Delta variant. That doesn't mean that it doesn't exist. I'm not saying that that you can't get a fever. I'm just saying that most people are not presenting with a fever. Some are, but just not most of everyone, right? So the symptoms of the Delta variant, specifically in children, include coughing, sneezing, they can complain of sore throat, headache, fatigue, runny nose. 74% of the time when we have a patient that has been a child, some of the studies are looking at this, 74% of the time, and this was a study that was done on, a case study done on some kids in Massachusetts. They found that 74% of the time, the children complained about having a runny nose. So now is the time to say, hey, you know what? I've got a runny nose. I need to call my doctor and find out, hey, do I need to be tested for COVID? Please do not ignore this symptom. Please do not send your children to school if they are sick. There is a lot of that going on where parents are sending kids to school and they're sick. If we are not sure that they are not negative for COVID, please do not send them to school. This variant is extremely contagious. It's 2 to 3 times as contagious as the strain that we're dealing, the alpha strain, which is what we were dealing with last year. So to give you just a little bit of what that means, before, like a year ago, if someone had COVID, they walked into a room, they may pass it on to 1 or 2 people. This particular strain is extremely contagious, so that one person positive may go into a room and can infect as many as 8 to 9 people. Will they always infect 8 to 9 people? No, they will not. Sometimes it will be just a few people, 4 or 5 people. Still 4 or 5 people too many, and still at least twice as much as what they would infect last year if they walked into a room and they had active infection. Does that make sense? I hope that makes sense. So specifically for parents, a message I want to send to you is to know that, number one, that you're not helpless. Most of the symptoms of COVID-19 in children, most children, are mild symptoms. Most children do not have severe illness. So then it begs the question, okay, Dr. Celeste, why are we seeing children in the hospital? Why are we seeing children on a ventilator? Well, unfortunately, we've left an environment wherein COVID-19, the Delta variant, has been able to just multiply itself and just continue to pass itself. So children that are 11 years age or younger who cannot be vaccinated, and anyone over that, they're a part of the unvaccinated population. The Delta strain seems to be thriving on this unvaccinated population, and that would include children. So we're seeing more children in the hospitals, and we're seeing more children, unfortunately, on ventilators because there's more infection that's going around. That's one of the reasons. The second reason would be is because it's extremely contagious. It's much more contagious than it was prior, especially in children. These are the children that we worry about for severe disease. These are not the only kids, because there's definitely kids that don't have severe disease that are ending up on a ventilator or ending up with severe infection if they're not vaccinated. And that is kids that have diabetes, kids that have asthma, and kids that are obese are at a higher risk for severe disease. So these are the kids that we want to make sure that we watch out for. We want to watch out for all kids. And God bless the teachers that are in classrooms having to help navigate all of this. But we especially want to make sure if you have a child and you know that they have diabetes, or you know that they have asthma, or you know that they're overweight, if they're 12 years or older, I strongly encourage you to get them vaccinated. That is one thing that you can do to help. Again, the reason we're seeing higher numbers in children and seeing severity of disease is because we're surging. There's lots of this infection that's going around, the Delta variant in particular. Now, the third reason why we're seeing an increase in the number of cases has actually to do with another viral infection that's going around. And this has been a little, physicians, we've talked about it, but may not be talking about it a lot in the general public, but RSV, there's been an increase in RSV cases, and RSV is respiratory syncytial virus. And what that is, that's a viral illness that we typically only see during the fall and winter months. We're seeing it now. One of the reasons we're seeing it now, two reasons actually. The first is that we stopped the mask mandate, right? We stopped that a little over a month ago. And so therefore we're seeing more of it because we're taking the mask off. In addition to that, children now are mingling more. Before, children were, we were kind of staying at home. There weren't summer camps, things like that. So that's causing an increase in cases. The reason why that makes a difference is because it's a respiratory illness that can have complications such as pneumonia and death as well, in addition to COVID-19. So children are having to kind of fight off or look out for, I'll say, two different viruses that have the potential to cause complications such as pneumonia and death. So very important that we do everything we can to decrease the spread of these viral illnesses. The things that we know will help with this are the things that we've been doing, guys, for the last year. That means keeping your mask on, and we want to make sure we keep it tight across the nose, very tight across the nose, not loose, not loosey-goosey. If I can see your nose, that means it's not working. That means respiratory droplets can shoot out, right? We want to make sure we're washing our hands and then using the appropriate social distance. Now, one of the things that we should mention here as well, one last thing, is that the fact that, okay, what can we do to help? This last thing that we can do to help. So the main thing is that everybody 12 years old or older to get vaccinated. There are 25 million children in the United States that are 12 years of age or older. Only 7 million children that are 12 or older have received at least one dose. So 7 million kids have gotten one dose of vaccine. That is one thing that we can do to help prevent the spread, especially in our household. And you say, well, why does that matter? If it's causing mild illness in kids, well, my kids are, are having mild illness. I don't really think that I want us to get the vaccine. I'm not that concerned about it. The reason that you should be concerned is because the kids can get it and get mild illness, right? The issue is that when the kids come home, if they are around other adults, especially older adults, grandparents, aunts, uncles, who have comorbidities, they can pass this virus along to them, and it can cause severe illness in that person that is older. We are seeing that patients that are vaccinated, we're seeing some breakthrough infections, and some people are concerned about that. Why are we seeing breakthrough infections? One of the reasons is because there's so many unvaccinated patients that are in the community, therefore leaving an environment wherein the Delta strain can infect that individual, infect other people, and it can infect someone that is vaccinated. The difference is, very key difference, because I had a patient say to me, well, Dr. Celeste, why should I get vaccinated? I already got COVID, why should I get vaccinated, right? The reason why you want to get vaccinated is to decrease the severity of disease and decrease the likelihood that that virus will utilize you as a host, okay? So people that are vaccinated, and we have data that proves this, have decreased intubations, decreased deaths for those patients that are vaccinated. They also present with less severe disease. One of the reasons that we had people to start masking again after, before initially it was, okay, if you're vaccinated, you don't need to mask. There's a study that the CDC performed in Massachusetts that discovered that although patients that were vaccinated, if they got COVID-19, had very few, very mild, maybe cold symptoms, right? But unfortunately, they had an amount of antigen or virus in the nose that could allow them to pass it to someone else. So to address that, the recommendation was that they do what? Masks to prevent that viral antigen from leaving their nose and infecting someone else. So that's all we had to share today. I know that I was probably talking really fast. We are at lunch now. I am in the clinic today and we're doing COVID testing as well as vaccines. As a matter of fact, if there's anyone out there who knows someone that wants to get vaccinated, someone who hasn't gotten vaccinated, someone who has questions about being vaccinated, someone who has concerns, any of that, we're more than happy to address that. Our office, we offer vaccinations Monday through Friday, 8:30 until 4 p.m. Okay. And that's Monday through Friday. So you always have somewhere that, every day that you can go to get a vaccine if, you're concerned about appointment or something like that. Number two, if you are we are now entering fall. It's humid outside, but you know how we in Alabama go back and forth between it's hot, it's cold, it's hot, it's cold. We're going to do that dance for a couple months probably, right? Right. So during this time of year, I'm talking to our chronic allergy sufferers and people have chronic sinus infections. Please, 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 if you're not already, please take your maintenance medication. Why? Number one, to prevent you from developing nasal congestion, postnasal drip, any of that we could get concerned that it's COVID-19. Okay, that's the first reason. Second reason is if you are someone that has chronic allergies and let's say you feel like, I'm feeling a lot of congestion in my nose. Please, please, please call your physician. Get a COVID test. If you can't get in with your physician, we're more than happy to service you. Please go get tested. Please do not send your children to school sick. Please do not send your children to school sick. Please do not send your children to school sick. That will exacerbate what we're dealing with currently. And what we're trying to do are a lot of healthcare workers are fatigued and tired and overworked, and I know that and from every capacity that people are dealing with a lot. These are the people that we have in hospitals that are there to care for us when we have heart attacks, strokes, now dealing with respiratory distress as a result of COVID-19 and multiple other lung and respiratory issues. So we want to be good stewards of that. And in that capacity is very important that if you're having symptoms, please be tested before you're around someone else. This particular strain is extremely contagious, so it's a lot easier for you to pass it on to other people than you think that it is. So please, 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 do not send your children to school sick. That potentially could start a little increase in cases in that particular school and community. Does anyone have any questions? We have a few minutes before we have to say. I see a lot of people signing in. Hey, Auntie Jean. Hey, Natasha, signing in from Montgomery. And hey, Kim from Chicago. Hey, Miss Bryant. Hey, Miss Smith. Hey, Miss Faith. Hey, Vinay from Montgomery. Hey, Miss Clark. Hey, Auntie Jean. So she said, will the COVID test work to detect the Delta variant? I thought the symptoms were different. Okay, so, and I get this question a lot. So the symptoms of COVID for the Delta variant are different than the symptoms for the Alpha strain or for the other strains. The reality is that when they say that the symptoms are different, they're talking about most of the symptoms that present. That does not mean, oh, if I don't have this symptom, then I know I don't have it. When we dealt with the Alpha strain, most people presented that had COVID presented with cough and shortness of breath. Those are the first two symptoms we talked about in relation to COVID-19 infection a year ago during last summer, right? Well, this year, or for this particular strain, some of the symptoms people present most with include runny nose, having a cough, sneezing. A lot of people are getting headache and fatigue. So it's a myriad of symptoms. I've seen people present with just shortness of breath. I've seen people present with just a cough. So I never ever tell patients, it's only these symptoms. That means that you don't have it. because we in the state of Alabama are in a high, we're surging right now, a high transmission rate at this point, it's very important to have those symptoms checked out. So call your doctor, call your primary care physician. If you can't get in with them, you definitely can come and see us or go to urgent care. There are a lot of resources available for you to be able to determine, hey, do I have COVID? I know that UAB has started their testing they do in a parking deck. I think they've restarted that as well. So you have lots and lots and lots of avenues for you to get tested. When the surging is happening, that's when it's important that we do a lot of testing so we know who is safe and okay to be around others. Who do we need to isolate and keep away from other people? That is so, so important at this venture, especially because us getting vaccinated and helping to decrease the spread of this disease helps to protect our children that are 11 years old and younger. That's what we've got to remember. They can't get the vaccine right now, right? So everything that we can do should be centered around trying to be of assistance and helping to decrease the spread in that population, okay? So yeah, Auntie Jean, the symptoms are a little bit different. But I've seen people present with all symptoms of COVID with every single strain. So I don't make a lot of differentiation. I will say that a lot of people have runny nose. A lot of people have sneezing and cough, and have a lot of upper respiratory things and not presenting with as much in terms of chest symptoms. But that doesn't mean that you won't have that, because we have had kids that presented and say, oh, my chest hurt or my ribs hurt, and those kids have had pneumonia. Okay. Let's see. Cheryl Faith, schools know they can't properly social distance, so why are they forcing kids into the classroom? Oh, Miss Faith. So I don't have an answer to you for that one. A lot of people have talked a lot. It's very political at this point about children being in school virtually versus in person, the difference in how much they've learned and all those kinds of things. And I, to be honest, try to stay away from those conversations, with the exception of noting that I definitely am a firm believer that all children should be masked when they're in school, as well as the teachers, to help protect the students and help to protect those families that those children will go home to. Especially in the sense where you have older grandparents, people with autoimmune diseases, you even have other children who are immunocompromised in the same household. So it's just a very touchy situation. So I just pray that we can be over that. I just pray that as many people get vaccinated as possible to help rid us of this disease. You're a hometown girl. We love you in here. Thank you, Mr. Cleveland. I definitely am a hometown girl. Grew up in Montgomery, not born, but raised in Montgomery since I was 4 years old. So I am a product of Montgomery, Alabama, very proudly a product of Montgomery, Alabama. What's the best way to protect children attending daycare that can't wear masks? So if I were, and I have two sisters that have kids that are young in daycare, Benet, the kids, their ages. And so what both of them have been able to do, and I've talked with a few friends about, is a lot of them have cameras in the daycare centers now that they allow you to watch. One of the ways I know that they're helping to protect the students is not allowing parents inside each classroom. There's administrator or a teacher that's there to pick up the child when they initially come in, other than having them wash their hands frequently and making sure that daycare has as many cleaning supplies as you can possibly imagine. I would inquire if they'll share it with you as to whether the teachers are vaccinated or not, because that presents a different kind of environment. If you know that all the staff is vaccinated, I know that some schools are requiring that. I'm not up to date on all of it to tell you who is and who isn't, but those are the questions that I would be asking. I would be packing up and buying. I know that I bought a bunch of wipes for the gym that my husband and I go to, and it's a smaller gym, so it's very, you have and knowing the other people that are in the gym, we know that most of those people are vaccinated, and that you can kind of tailor when you go in, that kind of thing. But I made sure that I took some Lysol and some extra wipes to the gym, because I want to make sure we have more than enough. So I would do the same thing if I were a parent. I would and partner with the teacher and the principal and find out, hey, what do we need? What else can we do to make sure our students stay safe? Making sure they have extra masks. The moment that my child turned 3 years old, though, I would be teaching a child how to wear a mask. My little nephew, Judah, bless his little heart, as sweet as he can be, is very proficient and knows how to wear his mask, and he's only 3. So children are very, very intelligent and can learn very easily, and model it at home for them so they know what they're supposed to do when they go out. any insights on how the booster vaccination will roll out. So booster vaccination right now is for the immunocompromised. You should be hearing from someone from the health department, or someone should be making an announcement when they will start that booster vaccination. I know that some places have already started. I'm not sure about Texas, Auntie Jean, but I would call your doctor and ask her ask her when. Ask her when they will start. I'm not sure about what they're doing in Texas. I know that here I'm waiting to hear back, and I'm checking rather with our Department of Health to make sure that we're in alignment and in sync with what they'll be rolling out here. But we definitely will be providing booster doses. Does anyone have any other questions? It's 12:30, so I've got to go start back doing my COVID testing in just a minute. But does anyone have any other questions? But thank you guys for coming on. To please stay safe, y'all. Please stay safe, and especially everybody that's related to me. I see a couple of you. Anyway, it doesn't matter whether you're related to me or not. I'm just going to say this. Please make sure, I'm saying they're related to me because they've heard me say this repetitively. That's why I said that. But this applies to anyone. The things that I'm doing right now to help keep myself healthy and to make sure that Celeste doesn't get sick, Celeste is working out feverishly, finding some way to get it in. I'm running up and down the stairs doing COVID testing anyway, so that's going to help. So exercise helps to boost your immunity. I'm making sure I drink plenty of water. Water helps to wash out viruses and bacteria from our system. Your kidneys need water adequately to function properly. You want to make sure your kidneys are working well during this period of time, obviously. I'm making sure that I take my multivitamin, and I actually have a line of vitamins, but I'm taking my multivitamin. I'm also taking, I'm vitamin D deficient. So I'm making sure that I get in my vitamin D. I'm also making sure that I have a serving of kale or spinach every day. In addition to that, I am making sure I'm very careful. I always make sure I have hand sanitizer in my car. After I've touched door handle, I'm constantly washing my hands. The moment I enter my house, I strip down, wash my hands. I make sure whatever has touched outside does not go beyond my washroom. So I don't have to worry about tracking germs and things like that in. I'm also making sure that I wear my mask. I have masks everywhere, as you can possibly imagine. When I go out places, when I'm inside a store, I'm always making sure that I'm masked. I will not ride an elevator. I will not get into a car. Very tight spaces. I'm very careful about who I get into those spaces with. I encourage you to do the same. What else are we doing? Exercise, water, vitamin D, exercise. Making sure everyone around you is vaccinated. Finding out the reasons why they may be opposed, and please don't be mean to people that are not vaccinated, y'all. Please be nice to them. There are a lot of reasons why people have apprehension about the vaccine, and that's okay. But I think that being kind and nice to people is something that's just at baseline that we should all do. But they're in a position wherein they're not vaccinated, so they're not necessarily protected. But there's a lot that they're going through and thinking about that. And so there's no reason for us to pack it on to be mean or ugly to them. Just be a resource for them. We're trying to be a resource for them. Answer any questions that they have. Help them find the right answer if they can't find it. Help them find a ride if they can't find it. We are doing I almost forgot to mention this. So on this Saturday, we're doing a vaccine rally. It's being hosted by the UAB Minority Health and Health Disparities Research Center. They are hosting a vaccine rally at Legion Field on Saturday from 11 a.m. Sorry, I was right. 11, so many events. 11 a.m. to 1 p.m. at Legion Field. It's being hosted by UAB Minority Health Disparities and Research Center, as well as Charles Barkley. He will be there giving comments. They're giving away free T-shirts. We will be providing the drive-through vaccinations. Alabama Regional Medical Center will provide the walk-up vaccination. So we're doing that in conjunction and together. Just trying to help people get vaccinated, guys. Just trying to help people get vaccinated. We'll have like little giveaway bags for you guys as well. So come out, bring someone out that you know is not vaccinated. Mask up, of course, when you come. But just trying to provide as many resources as possible, and as many ways as possible to provide the vaccine to anyone. So if there is anyone needing a vaccine, or you know someone that does, and let me just say this, if you know someone that needs a vaccine, Monday through Friday, 8:30 to 4, you all can call my office. I promise you, we will vaccinate you. It's Pfizer vaccine and Johnson & Johnson. Our office number is 205-291-8842. Yes, and Auntie Jean did a great workout, exercise, lots of water, multivitamin, vitamin D, kale or spinach every day, mask, be careful of tight spaces. Exactly, Auntie Jean. And please do not do this unless it is your child, or unless you're the person that's the healthiest person that can bring the person. If you know that you have heart disease or diabetes, asthma, or lung disease, please try to avoid driving that person in that you think may have COVID in for a test, if you can avoid it. Sometimes we can't, but if you do have to do it, please make sure that you get a KN95 mask or an N95 mask to where you can get them online at Amazon. I think there's no shortage on KN95 masks for sure. That's a little pink mask I wear all the time, extremely comfortable. Vince, my husband, wears the black one, extremely comfortable. I wear it in all environments, and it's helped thus far by God's grace to help keep me safe. So that's what we're doing. I just wish God's blessings on all of you, and I hope that everyone stays safe. If you have questions about getting vaccinated and not really sure what to do, definitely give us a call and make an appointment. Other than that, I hope you guys stay safe, and I hope you have a good day. Okay? Bye. Have a good day, everybody. Thanks for tuning in.